thanks. And as someone who's had his share of surgery, listen to this next story. It's the ultimate nightmare for anyone undergoing surgery, waking up in the middle of the procedure. For Kelly Haapala, it wasn't a nightmare. It actually happened during surgery to replace her hip socket 5 years ago. And Dr. James Cottrell is the past president of the American Society of Anesthesiologists. Good morning to both of you.
Good morning.
So 5 years ago, you're having hip surgery. You're on the operating table, and somewhere in the middle of the procedure, you realize you're awake.
Right.
Describe that moment for me.
Well, it's like you're coming out of a dream. You're not sure what's going on, and it's kind of fuzzy. And then as you're realizing more and more, you're in the middle of surgery, and I couldn't feel everything at first. I just had the sensation of hearing all the conversations and what was going on.
But eventually you started to feel the pain.
Yes. Yes.
And what did you try to do to signal the doctors or the medical team that you were in fact with them, awake in the room?
I was trying to move everything, hands, fingers, head, eyes, mouth. Inside I was screaming, thinking they can hear all the sounds I'm making, but they couldn't.
And so how long was it before you actually could make them realize that you were alert?
Well, it seemed like an awfully long time, but it was probably about 10 or 15 minutes from what the records show.
And the pain during that time, how would you describe it?
It was unbearable for those last few minutes once the pain medication that they had given me worn off.
Okay, they gave you more anesthesia, you went back under, they finished the surgery. When you woke up, Kelly, did you immediately recall what had happened?
Yes. I was screaming to my family and to my doctor. I woke up, and that was all I could think about. Not that my hip was better or anything. I wanted them to know.
Why does this happen, and how often does it happen?
Well, this is an extremely rare event, and although it's nonetheless tragic, and I think it's a terrible thing that happens, Mrs. Haapala is in the category of patients that we've identified in our new practice guidelines, and that's a traumatic patient who's had an automobile accident, that has low blood pressure, is bleeding, and then we have to do a delicate balance to keep her alive without reducing her blood pressure enough to cause her brain to die.
About 1 or 2 patients per 1,000, is that pretty accurate?
About 1 patient per 2,000.
And some patients are more prone to this than others.
They are.
Now the American Society of Anesthesiologists has guidelines. There's protocol for the operating room of the things you monitor to judge or gauge the alertness of the patient. But even in the new guidelines, doctor, this body has fallen short of recommending the use of a highly technical monitor called a BIS monitor. Why?
Well, I think there are a variety of monitors that we're using, and we're doing a lot of research to see what is the best way to prevent this. And this is simply one of those monitors, and more research needs to be done to be sure that it will identify the patients who would develop awareness during anesthesia.
This monitors brain waves, is that correct?
It is, but there are different leads that we use for the brain waves. So you can have 2 leads or 1 lead or 12 leads. So we have to be sure that this monitor will identify those patients. There are a lot of other things that we can look at during anesthesia, like the blood pressure, the pulse, sweating. And again, we have to balance that against the awareness that occurred in Mrs. Haapala. But she is the patient we've identified that's at risk for this developing.
And some hospitals do have these monitors on hand, we should mention. And they cost about between $5,000 and $10,000. Can a patient, if it's elective surgery, can a patient call a hospital and say, do you use that monitor? I'd like you to use it?
I think that a patient could call a hospital and see if we have that monitor. I think most hospitals have that monitor now. And for the high-risk patients, the anesthesiologist can choose to use that monitor. But again, that monitor is not definitely specific to prevent awareness. It requires a very large number of patients to study, between 10 and 15,000, so that we can prevent 6 out of 7 cases of awareness.
Kelly's going back in for surgery soon. Since this happened to her once, does that make it more likely that it could happen to her again?
Well, it probably does, but she was at special risk because she had low blood pressure from her trauma. She was badly injured, so I guess the anesthesiologist had to keep her alive during this procedure, so it's difficult to give her enough anesthesia to prevent awareness.
Kelly, are you going to make sure there is one of those monitors, whether it's proven or not, in the surgery, in the operating room the next time you go in?
Yes, I already have called, and they already have it all set up.
Well, she now is a different patient because she's coming for an elective procedure.
She's healthier at the time.
All the other monitors that we've introduced to save patients. In addition, if she wants the BIS monitor, there are other monitors other than the BIS monitor as well. There's PSI, there's entropy. So we're still studying to see which one is the best.
Again, 1 or 2 out of every 1,000 patients this does happen to. So clearly, in your case, traumatic. And I Pray for you that it doesn't happen again. Good
Yeah.
luck with your surgery.
Thank you.
Kelly, thanks very much. Doctor, thanks to you. We appreciate it. 39